A volunteer coordinator's voice carried across the hospital break room with that particular tone reserved for public humiliation. "Listen, Mrs. Volkov, we appreciate the enthusiasm, but coffee rounds and magazine sorting are more your speed. Let the actual medical staff handle the real work." Dr. Irina Volkov stood beside the supply cart, hands resting quietly at her sides. 68 years old, silver hair pulled into a practical bun, blue volunteer vest over a simple gray cardigan. She didn't flinch, didn't argue, just nodded once, slow and deliberate, the way someone nods when they've heard this particular song before and know all the words. "Of course, Dr. Webb." Her accent carried the faint echo of Eastern Europe, softened by decades in America, but still there in the vowels, in the careful precision of each consonant. Marcus Webb turned back to the cluster of residents and nurses, dismissing her with the efficient brutality of someone who'd already forgotten she existed. "Before we begin, tell us where you are watching from. And if you want to support the channel, please subscribe and hit the like button on this video." Irina moved to the coffee station, her hands marked with age spots and thin scars that traced across both forearms like pale rivers, worked with economical grace. No wasted motion, no tremor. She poured, she stirred, she arranged cups on the cart with the same methodical calm a surgeon uses to arrange instruments on a sterile tray. Nobody noticed, except Paul Hendricks. The charge nurse leaned against the medication dispensary, arms crossed, watching Irina the way you watch something that doesn't quite fit. Paul was 54, ex-army medic, and he'd spent enough years in field hospitals to recognize certain things. The way she moved, for instance. The way she positioned herself, with her back never quite to the door. The way her eyes tracked movement in her peripheral vision. Constant threat assessment masked as elderly docility. And those scars. He'd seen burns before. Knew the difference between kitchen accidents and something else entirely. The patterns on her forearms were old, faded to white, but deliberate, symmetrical. The kind you get from holding something radioactive while everyone else runs. "Mrs. Volkov," he said, voice low enough not to carry. She looked up. Her eyes were gray, almost colorless in the fluorescent light, and for just a second, Paul saw something in them that made his spine straighten. Not hostility, not fear, just assessment. Clinical, complete. The way a combat medic evaluates a battlefield in the 3 seconds before deciding who lives and who doesn't. Then it was gone, replaced by the pleasant blankness of an elderly volunteer who just wanted to be useful. "Yes." "Mr. Hendricks, you worked medical before, didn't you?" Pause, half a second too long. "Long time ago. Different country, different life." She pushed the coffee cart toward the door. Paul watched her go, watched the way she moved through the space like water, never quite touching anything, never quite making sound. Muscle memory, the kind you don't lose even after 40 years. "Hey Grandma, don't forget the ER station." Jessica Reeves, the hospital's social media coordinator, barely looked up from her phone as Irina passed. 29, aggressively confident, and currently filming a video about the hospital's inspiring volunteer program that somehow always managed to frame the elderly volunteers as endearing incompetents. Of course, Irina pushed the cart into the hallway. The wheels squeaked, fluorescent lights hummed overhead. Someone's pager chirped in the distance, shrill and insistent. She paused at a junction in the corridor. Head tilted slightly, listening. From 3 hallways away, a sound. Faint, mechanical, rhythmic clicking. Her hands tightened on the cart handle. Nobody else heard it. The nurses walked past, laughing about weekend plans. An orderly pushed a gurney, scrolling his phone. Dr. Webb emerged from the break room, already shouting into his cell about scheduling conflicts. But Irina heard it. That specific click and whir. Geiger counter. Old model, Soviet era. The kind that counted in Reutens instead of grays. She knew that sound the way other people know their children's voices. Her jaw tightened. Just slightly. Just enough. She continued pushing the cart, but her route changed. Subtle. One turn instead of another. moving toward the sound instead of away. The ER waiting area smelled like disinfectant and anxiety. Irina distributed coffee with the invisible efficiency of someone who'd spent a lifetime being overlooked. Families took cups without looking at her. Nurses accepted them with distracted thanks. She worked her way toward the intake desk. The clicking was louder here. A man sat in the corner, late 40s, wearing a lab coat over civilian clothes. His hands shook. Sweat beaded on his forehead despite the aggressive air conditioning. And beside his chair, half hidden under a jacket, a yellow and black device about the size of a brick. Dosimeter. Reading 4.7 Röntgens. Irina's breath didn't change. Her expression didn't shift, but her hands stopped moving for exactly 1 second. 4.7 Röntgens. Acute exposure. Industrial accident, probably. Cesium or cobalt source. He had maybe 6 hours before the prodromal symptoms became critical. 12 before his bone marrow started to fail. She approached the intake nurse, an older woman named Carol, who actually bothered to learn volunteers' names. The man in the corner, Irina said quietly. How long has he been waiting? Carol glanced over. Dr. Klein? Came in about 20 minutes ago. Says he feels nauseous. Thinks it's food poisoning. We're slammed, so he's waiting for the next available. She shrugged. He's a researcher at the university. Probably just stressed. He needs to be seen now. Something in Irina's voice made Carol look up. Really look. Mrs. Volkov? He has been exposed to radiation. Industrial source. He needs immediate decontamination and chelation therapy. He has hours, not days. Carol's face went blank with incomprehension. How do you... Please, page Dr. Webb. Tell him code silver. Tell him we have acute radiation exposure, and the patient is ambulatory but deteriorating. Code silver isn't. It should be. Page him now. Irina moved toward Dr. Klein before Carol could respond. She knelt beside him, her knees protesting but her movements smooth, practiced. Dr. Klein, she said softly, I am Irina. I volunteer here. You have been exposed to radiation, yes? His eyes focused on her with desperate relief. The cesium source, the shielding failed. I didn't think. I was only there for maybe 90 seconds. How much exposure? I don't know. 4, maybe 5 Röntgens. When? 3 hours ago. Her hand touched his wrist. Pulse rapid, fretty. Skin cool and clammy. Textbook prodromal phase. Behind her, Dr. Webb's voice cut through the ER noise. What the hell is going on? Carol, what's this about? He stopped. Irina stood, turning to face him. Her gray eyes met his without deference, without apology. This man has acute radiation syndrome. He needs isolation, decontamination, and immediate chelation therapy. Prussian blue if you have it. If not, DTPA. His bone marrow will begin to fail in 8 to 10 hours. Webb stared at her. Who do you think? I think he will die if you wait. I think you have no protocol for this because you have never needed one. And I think you should listen. Silence spread outward like a shockwave. If you want to see how Irina saves a life everyone else missed, make sure you subscribe to Emergency Heroes Stories, because what she does in the next few minutes will leave you speechless. Dr. Webb's office smelled like leather and ambition. Framed diplomas lined the walls. A photo of him shaking hands with the hospital CEO occupied prime real estate behind his desk. Irina sat in the visitor's chair, hands folded in her lap. While Webb paced behind her, like a prosecutor preparing closing arguments. You don't get to diagnose patients, Mrs. Volkov. You pour coffee, you smile, you make families feel welcome. That's the volunteer job description. She said nothing. Dr. Klein is being evaluated by actual medical staff. If there's radiation exposure, we'll handle it through proper channels. What you did out there was unauthorized, inappropriate, and frankly dangerous from a liability perspective. Is he in isolation? Webb stopped pacing. Excuse me? Dr. Klein, did you isolate him? Did you begin decontamination? That's not your concern. Did you test his blood? White cell count will drop first. Lymphocytes specifically. You need a baseline now, before the count crashes. Webb leaned against his desk, arms crossed. Where exactly did you get your medical degree, Mrs. Volkov? I did not say I had one. Then maybe you should leave the medicine to people who do. The door opened. Paul Hendricks stepped inside, still in scrubs, holding a tablet. His face carried that particular tension of someone delivering news nobody wants to hear. Dr. Webb. Dr. Klein's preliminary blood work came back. Webb straightened. And? White count is 2.1. Lymphocytes at 890. He's dropping fast. Paul's eyes flicked to Irina, then back to Webb. Environmental health came up from the basement. They swept him with a survey meter. He's hot. Not enough to contaminate others, but enough to confirm significant exposure. Silence filled the office like water filling a sinking ship. They want to know if we have Prussian blue in pharmacy, Paul continued, and whether we have anyone on staff who's actually treated acute radiation syndrome before, because none of the attendings have. Webb's jaw worked soundlessly for 3 seconds. Irina stood. I will go now. You have work to do. She moved toward the door. Wait. Webb's voice had lost its prosecutorial edge. How did you know? The dosimeter. He had one clipped to his belt, and I have seen this before. Where? She paused at the threshold, one hand on the doorframe. Different country, different life. Then she was gone, moving down the corridor with that same economical grace, invisible again in her blue volunteer vest. Paul watched her go. You know she's right about everything, right? Klein needs chelation therapy within the next few hours, or his bone marrow is cooked. Webb ran a hand through his perfect hair, disrupting it for the first time anyone could remember. Who the hell is she? In the break room, Jessica Reeves sat with 2 other volunteers, scrolling through footage on her phone. The screen showed Irina kneeling beside Dr. Klein, speaking quietly while chaos erupted around her. I'm telling you, this is gold, Jessica said, thumbs flying across the screen as she edited. Elderly volunteer thinks she's a doctor. Tries to diagnose radiation poisoning like she's in some Cold War movie. It's trending already. The other volunteers, both retired teachers in their 60s, exchanged uncomfortable glances. Jess, maybe don't post that, one said. If she was actually right, she got lucky, or she overheard something. Either way, it's hilarious content. Jessica hit post, adding hashtags with practiced efficiency. Grandma plays doctor, volunteer gone wild. This is getting at least 50,000 views. Across the room, partially hidden behind a newspaper, Irina sat at a corner table with untouched coffee growing cold in front of her. She wasn't reading, just sitting, breathing. Her hands rested flat on the table, and if you looked closely, very closely, you could see the slight tremor she'd been suppressing since seeing that dosimeter. 4.7 retins, the number circled in her head like a vulture. She'd seen that number before. April 27, 1986, the day after the reactor exploded. The day they brought in the first wave of firefighters, their skin already reddening, their eyes confused because they felt fine. They felt strong. They didn't understand that they were already dead. She closed her eyes, forced the memory back down. Not here, not now. Mrs. Volkov? She opened her eyes. Carol from intake stood beside the table, holding a clipboard and wearing an expression of careful neutrality. Dr. Webb wants you in the ER. Dr. Klein is asking for you specifically. Irina stood without a word, smoothing her cardigan with hands that no longer trembled. The ER had reorganized itself around Dr. Klein like a body forming scar tissue around a wound. He'd been moved to an isolation room. Plastic sheeting hung in the doorway, and a bright yellow radiation trefoil marked the entrance. Webb stood outside, now wearing a dosimeter of his own, looking deeply uncomfortable. He won't take the chelation therapy until he talks to you, Webb said flatly. Says you're the only one who understands what he's going through. So congratulations, you get 5 minutes. Don't touch anything. Don't promise anything. And for God's sake, don't pretend you're a doctor. Irina nodded once and pushed through the plastic sheeting. Inside, the air tasted recycled. Dr. Klein sat on the bed, IV already in place, looking somehow smaller than he had in the waiting room. Younger, afraid in the way only someone who understands exactly what's happening to them can be afraid. You've seen us before, he said. Not a question. Yes. How bad is it? She pulled a stool close, maintaining proper distance, but near enough that he could see her eyes. Your exposure was significant but not lethal. With treatment, you will live. Your bone marrow will recover. You will feel very sick for some weeks. But you will live. You sound certain. I am. Because you've treated this before. Pause. Yes. Where? Irina glanced toward the plastic sheeting, toward the shadows of people moving beyond it. Wed. Paul. Others listening. A place where many people were exposed, she said carefully. A long time ago. I was younger then. I had different resources. But the medicine is the same. The body responds the same. You will survive this, Dr. Klein. He studied her face, searching for lies and finding none. Okay, he whispered. Okay, I'll do the treatment. She stood. Good. Do everything they tell you. Rest. Drink water. Let the medicine work. Will you check on me? Something shifted in her expression, softened. Just for a second. If they allow it, yes. Outside the isolation room, Paul waited with his arms crossed and his head tilted in that particular way that meant he'd made a decision. 1986, he said quietly. Chernobyl. Irina's face became stone. Those scars on your arms. I've seen radiation burns before. And the way you knew the exact symptoms, the exact timeline, the exact treatment. You were there, weren't you? She met his eyes. I poured coffee, Mr. Hendricks. That is what I do here. That's not an answer. It is the only answer I have. She walked past him, back toward the volunteer station, back toward invisibility. But Paul stood watching her go, and his expression carried the weight of recognition, of respect, and questions that wouldn't stay buried much longer. The call came at 2:47 p.m. on a Tuesday that had been, until that moment, unremarkably slow. Pediatric emergency incoming. 8-year-old male, severe anaphylaxis, EpiPen administered 12 minutes ago with minimal response. EMS is 3 minutes out. The ER shifted into controlled chaos. Nurses prepped the trauma bay. Residents scrambled for positions. Dr. Webb appeared from his office, already snapping orders. Irina stood at the volunteer station, restocking pamphlets about diabetes management, apparently unaware of the urgency unfolding 30 feet away. Paul noticed her stillness, the way her hands had stopped moving, the way her head tilted slightly toward the trauma bay doors, listening. The ambulance arrived with sirens dying mid-wail. Paramedics burst through, pushing a gurney at near running speed. The child on it was small, Hispanic, his lips blue-tinged and swollen. His mother ran alongside, sobbing in Spanish, her hands reaching but not touching. Tommy Vasquez, 8 years old, ate something at a birthday party. Peanut exposure, we think. First EpiPen at 2:35, second at 2:41. Minimal improvement. Stridor increasing. O2 sat at 84 and dropping. They transferred him to the bay. Webb moved in, efficient and controlled. Get me 0.3 milligrams epi. IV access. Prepare for intubation if he drops below 80. The team moved like a machine. IV in. Oxygen mask. Monitor leads attached. The machines began their electric symphony of beeps and alarms. Tommy's oxygen saturation hit 81, then 78. His chest heaved with the effort of breathing through a closing airway. The stridor, that high-pitched crow of obstructed breathing, grew louder. Desperate. He's not responding. One of the residents said, voice climbing. Epi's not working. Webb's jaw tightened. Prepare for crash intubation. Get me a pediatric blade and a 6.0 tube. Airways too swollen, another resident said, staring at the monitor. We're not going to be able to visualize the cords. Then we do a surgical airway. He's 8 years old. And he's dying. Move. Irina appeared in the doorway of the trauma bay. No announcement. No permission. Just there. Suddenly, still wearing her volunteer vest over her cardigan. There is another option. Every head turned. Webb's eyes flashed. Mrs. Volkov, get out, now. He has paradoxical reaction to epinephrine. Rare, but I have seen it. The adrenaline is causing vasoconstriction that makes the swelling worse. You need methylene blue. 5 milligrams per kilogram. IV push. Silence. E. Complete. Total. Tommy's oxygen hit 75. That's not a standard protocol, Webb said. No, it is not. But it will work. How do you know? Because I have done it before. 3 times. All 3 survived. The monitor alarm screamed. 72%. Webb looked at Tommy, at his blue lips, at his mother being held back by security, at the numbers dropping despite everything they were doing. If you're wrong, he dies. If you intubate through that airway, he dies. If you do surgical airway on a child, you may save him, but you will damage him. This will work. 70%. Paul spoke from behind her. I'll get the methylene blue. He was moving before Webb could respond, pushing past residents toward the medication dispensary. Webb stared at Irina. If this goes wrong, then you blame me. I accept this. Paul returned in 40 seconds that felt like 40 minutes, syringe in hand. 5 milligrams per kilogram. Kid weighs 26 kilos. That's 130 milligrams. He handed it to Irina. She didn't take it. You must do it, Mr. Hendricks. I am volunteer. I cannot touch patients. Their eyes met. Understanding passed between them, silent and complete. Paul moved to Tommy's IV port. Somebody want to tell me I shouldn't do this? Nobody spoke. He pushed the plunger. The methylene blue entered Tommy's bloodstream in a slow, deliberate stream. The solution was dark, almost ink-like, and for a moment, nothing happened. The monitor continued its terrible countdown. 68%. Tommy's mother screamed something in Spanish. A prayer, maybe, or a curse. Then Tommy gasped. Not the stridor. A real breath. Deep and wet and desperate, but real. His oxygen saturation stopped falling. Held at 68 for 3 seconds. Then climbed. 70. 74. The swelling in his airway began to recede, visible in real time as his lips lost their blue tinge, as his chest stopped heaving with quite so much panic. 81, 85, 90. The room released a collective breath it hadn't known it was holding. Webb stepped back from the bed, hands still gloved, staring at the monitor like it was showing him something impossible. How did you? But Irina was already moving toward the door. Mrs. Volkov. Webb's voice stopped her. Where did you learn that? She turned, and for just a moment, everyone in that trauma bay saw something in her eyes that had nothing to do with coffee rounds or magazine sorting. A place where we did not have many resources, she said quietly. Where we had to be creative. Where children died if we were not. What place? Different country. Different life. Tommy coughed, a wet, productive sound that was nevertheless the most beautiful thing his mother had ever heard. She pushed past security and collapsed at his bedside, sobbing his name. Irina watched for a moment, her expression unreadable, then walked out of the trauma bay. Paul followed her into the corridor. That was a Soviet-era protocol, developed in the 70s for battlefield medicine when standard drugs weren't available. She didn't stop walking. Was it? I looked you up. There's not much. Irina Volkov emigrated to the U.S. in 1987, became a citizen in 1993, worked as a private practice internist in Boston until retirement 5 years ago. He paused. But there's a gap. 1980 to 1987. Nothing. No records, no employment history, nothing. Perhaps I was not employed. Or perhaps your records were sealed. Soviet military doesn't exactly publish personnel files. She stopped at the volunteer station, turned to face him. Why does it matter to you, Mr. Hendricks? Because I watched you save that kid's life with knowledge that doesn't exist in any current medical database. Because you recognized acute radiation syndrome before anyone else even considered it. Because you move like someone who's worked in war zones. He crossed his arms. And because those scars on your arms are from holding radioactive material with inadequate protection. I've seen enough burns to know. Irina's hands moved to her forearms, an unconscious gesture, covering the old scars with her fingers. I was a doctor, she said finally. A long time ago, in USSR. I did what was necessary. Now I pour coffee. This is enough. Is it? She didn't answer. Down the hall, Jessica Reeves stood with her phone out, filming. She'd caught the last 30 seconds. The conversation, the scars, the admission. Our thumbs flew across the screen. New video uploading. Caption, hospital volunteer claims to be Soviet doctor. You won't believe what happened next. Irina saw her. Their eyes met across the corridor. Jessica smiled and hit post. The emergency alert came through at 4:15 p.m. while Irina was restocking glove dispensers in the supply closet. Mass casualty incident. Construction site collapse. Multiple traumas incoming. All available personnel to ER. Repeat. All available personnel to ER immediately. The overhead speakers crackled with barely controlled urgency. Footsteps thundered through corridors. Pagers shrieked in overlapping chorus. Irina set down the box of gloves and moved toward the ER. Paul intercepted her at the double doors. Mrs. Volkov, you need to still back. This is going to be bad. Through the glass, she could see controlled chaos organizing itself. Gurneys lined up, trauma base cleared, residents pulling on gowns with shaking hands. How many? She asked. 6 critically injured. Steel beam collapse. Construction crew was 40 foot up when the support gave way. His face was pale. We don't have enough surgical staff on site. We're pulling people from other departments. The first ambulance arrived. Paramedics exploded through the doors, pushing a Bernie at full speed. The man on it was screaming, conscious and thrashing. A section of rebar protruded from his abdomen, maybe 18 inches of rust-stained steel, entering just below his ribcage and exiting near his hip. Blood soaked through the makeshift padding they'd wrapped around the entry point. James Reed, 34, impaled by rebar, lost consciousness twice on scene. BP 90/60 and dropping. 2 large-bore IVs running wide open. They rushed him past. His screams echoed off tile walls. 2 more ambulances. More gurneys. More blood. A man with his leg bent at an impossible angle, bone visible through torn jeans. Another with crush injuries to his chest, breathing in short, gasping sits. A younger man, maybe 25, his arm nearly severed at the elbow, tourniqueted with someone's belt. Dr. Webb stood in the center of the chaos, triaging with rapid-fire precision. Reed goes to trauma 1. He's the most critical. Chest crushed to trauma 2. Compound femur fracture to 3. Partial amputation, holds in the hallway until we have a surgeon free. The young man with the destroyed arm heard that. His face went gray. Wait, what? You're making me wait? We have 3 trauma bays and 6 critical patients. I'm sorry. 2 more ambulances pulled up outside. Paul looked at the growing line of gurneys, at the residents already overwhelmed, at Webb's face tight with the mathematics of triage. We need more hands. Webb spun, scanning the ER. His eyes landed on Arena, still standing by the doors. For 3 seconds he said nothing. Then, can you actually do medicine, or was that luck earlier? I can do medicine. Prove it. Take the partial amputation. Keep him stable until we can get him to OR. If you kill him, it's on me, not you. Before we continue with what happens next, make sure you subscribe and hit the like button. Comment below and tell us what you think Arena will do next, because what's coming will shock you. Arena moved without hesitation. She pulled a gown from the wall dispenser, tied it as she walked, grabbed gloves from a passing cart. The young man lay on a gurney in the hallway, his right arm a catastrophe of torn flesh and exposed bone. The tourniquet was holding, barely. His name tag, somehow still attached to his shirt, read, Martinez. Mr. Martinez, she said, her voice calm and level. I am Arena. I am going to take care of you. My arm, he gasped. I can't feel my arm. That is the tourniquet. It is saving your life. Now I need you to stay very still and let me work. She examined the damage with hands that didn't shake. The elbow joint was destroyed. Radial and ulnar arteries severed. Nerve damage extensive. But the brachial artery above the tourniquet was intact. And if she could control the bleeding, if she could preserve what tissue remained, the surgeons would have something to work with. Paul appeared beside her with a suture kit and irrigation supplies. What do you need? Saline, sterile drapes, and 4 units O-negative standing by. You planning to reattach it here? No, but I am planning to make sure there is something left to reattach. She worked with methodical precision, irrigated the wound, debrided the obviously non-viable tissue, identified the severed vessels, and clamped them individually. Her hands moved with the confidence of someone who'd done this exact procedure dozens of times under far worse conditions. Martinez watched her work, his pupils wide with shock and morphine. You're really good at this. I have practice. Where'd you work before? Mass General? Johns Hopkins? Somewhere else. She ligated the radial artery. Clean tie, textbook technique. Behind her, she could hear James Reed screaming in Trauma 1. Could hear Webb shouting orders. Could hear the wet sounds of blood hitting tile floor. Her hands didn't shake, not anymore. Another ambulance, another gurney, this one carrying a man in his 50s, conscious but disoriented, covered in concrete dust. The paramedic's voice carried over the chaos. Possible internal bleeding, rigid abdomen. Mechanism suggests blunt force trauma. Webb appeared in her peripheral vision, moving toward the new arrival, then stopped, turned back. Mrs. Volkov, how's Martinez? Stable, bleeding controlled. He needs surgery within 2 hours to preserve maximum function, but he will not die in this hallway. Webb stared at her work, at the neat clamps, at the organized debridement. at Martinez's stable vital signs on the portable monitor. Where the hell did you train? She tied off the ulnar artery without looking up. Medical school in Moscow. Residency in a field hospital. The rest, I learned by necessity. What kind of field hospital? The kind that does not exist in official records. Movement at the ambulance bay doors. Paul's voice, sharp with alarm. Dr. Webb, we've got a problem. They turned. A man in his late 40s stumbled through the entrance on his own feet, waving off paramedics. Dr. Aaron Klein. The radiation exposure patient from 2 days ago. He should have been in isolation, should have been flat in bed receiving chelation therapy. Instead, he was here, his face the color of old newspaper, his legs barely holding him upright. There's been another exposure, he gasped. The university lab, same source, shielding failure, 3 people. He swayed. I came to warn you. They're coming here. You need to be ready. Then his legs gave out. He collapsed forward. Paul caught him, barely lowering him to the ground as gently as speed allowed. Get me a gurney, Paul shouted, but Irina was already moving. She dropped to her knees beside Klein, her gloved hands checking his pulse, his pupils, his skin temperature. How long ago, she demanded. 30 minutes, maybe 40. I don't know. I left as soon as I heard. How much exposure? I don't know. The counter maxed out. 8 Rentgens, maybe more. Her face went very still. 8 Rentgens. They're students. Graduate students. One is pregnant. Something shifted in Irina's expression. Something that had been carefully locked away for 38 years, suddenly pressing against a door that no longer quite held. Webb appeared above them. What's happening? 3 more radiation exposures incoming, Paul said. Worse than Klein. Much worse. We don't have the capacity. We're barely handling this trauma. Irina looked up at him. Her gray eyes were no longer calm. No longer carefully neutral. They were sharp. Urgent, absolute. You will make capacity, she said. You will clear isolation rooms. You will get every unit of Prussian Blue and DTPA in this hospital, and from every pharmacy within 20 miles. You will prepare for chelation therapy, for bone marrow depression, for acute nausea and hemorrhage. Mrs. Volkov, and you will let me lead it. Because I am the only person in this building who has treated mass radiation casualties. The only one who knows what 8 Rentgens means. The only one who has watched pregnant women die from it. Her voice didn't rise, didn't need to. Wed stared at her. Who are you? Someone who has seen this before. Someone who cannot watch it happen again. Sirens approached from the distance. Multiple ambulances. The radiation victims were 3 minutes out. Webb pulled Irina into an empty consultation room while the ER staff scrambled to prepare isolation protocols. The door closed with a hollow click that sounded too much like a cell locking. You need to tell me right now who you are and how you know this. Irina stood with her back straight. Hands at her sides. Through the small window in the door, she could see nurses hanging plastic sheeting, could see Paul directing traffic with the controlled urgency of someone who'd worked mass casualty events before. I told you, I was a doctor in Soviet Union. That's not enough. Not anymore. I've got 3 radiation victims coming in hot, and you're telling me you're the only one who can save them. I need more than vague references to Moscow and field hospitals. She met his eyes. What do you want me to say? The truth. Pause. Long enough that Webb thought she might refuse entirely. Then, I was military physician, Soviet Army, 1980 to 1987. I served in Afghanistan for 2 years. Then I was reassigned. Where? Her jaw tightened. A place where reactor number 4 exploded, where men went into burning radioactive core with shovels and wheelbarrows, where firefighters came to us with their skin falling off and their eyes melting, where we had no Prussian Blue, no DTPA, no modern chelation therapy, just morphine and prayer and the certain knowledge that most of them would die. Webb's face went pale. Chernobyl. Yes. You were there, during the disaster. I was there for 8 months after. Mobile medical unit. We treated liquidators, civilian evacuees, children from contaminated zones. We worked in tents 12 kilometers from the reactor, with dosimeters that clicked constantly, and protective equipment that was never quite protective enough. She held up her forearms, displaying the pale scars. These are from holding a child who had swallowed cesium. She was 3 years old. The decontamination equipment had failed. Someone needed to hold her still while we pumped her stomach. I volunteered. The radiation burned through my gloves in 4 minutes. Wed stared at the scars. The child lived, Irina continued. I received treatment. The burns healed. And I learned that 8 Röntgens is the border between maybe and probably not. Between fighting and praying. Between science and faith. How many did you treat? We processed over 400 exposures, ranging from minor to lethal. We saved 137. The rest. Her voice didn't waver, but something in her eyes dimmed. The rest we made comfortable. And the pregnant woman? Irina's hands clenched, just slightly. We lost all 3 pregnant women. Their bodies prioritized the fetus, concentrated the radiation there. The babies absorbed what would have killed the mothers quickly. Instead, both died slowly. Silence filled the small room like smoke. That's why you left, Wed said quietly. That's why there's no record of you between 1980 and 1987. Soviet government did not want records, did not want evidence of how many were exposed, how many died, how badly they failed to protect their own people. So they erased us, the mobile units, the field physicians, the ones who saw too much. She paused. I defected in 1987, sought asylum in West Germany, then came to United States, started over, became internist, treated diabetes and hypertension and high cholesterol. Ordinary medicine, safe medicine. Why didn't you tell anyone? Because I was tired of death. Because I wanted to heal people who would not turn black and vomit blood and beg me for morphine they could not have, because we had only enough for the ones who had no chance. Her voice remained level, factual. Because I wanted to forget. Webb's pager shrieked. He glanced at it. They're here, the radiation victims. Then we go. Wait, he blocked the door. I need to know something else. In Chernobyl, when you had cases this severe, what was the survival rate? For 8 Röntgen exposure, 20%, maybe less. And now, with modern treatment. Better, 40, maybe 50%. If we are fast, if we are perfect, if we are lucky. And the pregnant woman. Irina's expression became stone. I do not know. I never saved one before. She pushed past him, out into the ER. The ambulances had arrived. 3 gurneys pushed through doors now marked with radiation warnings and lined with dosimeters. Environmental health personnel in full protective gear flanked each patient. First gurney, male, early 20s, Asian, already vomiting into a basin. His skin had an odd reddish tinge. Second gurney, male, mid-20s, white, conscious but disoriented, trembling uncontrollably. Third gurney, female, late 20s, Hispanic, one hand pressed protectively tightly to her abdomen, 4 months pregnant based on the slight swell beneath her university sweatshirt. Irina's breath caught, just for a second. Then training took over. 40 years of training that didn't care about trauma or fear or the ghosts of 3 dead mothers from 1986. She moved to the charge board, grabbed a marker, began writing in clear block letters. Patient 1, trauma 4. Patient 2, trauma 5. Patient 3, isolation 6. All personnel who enter wear dosimeters and protective equipment. No one stays in rooms longer than 15 minutes. Rotation every quarter hour. Paul appeared beside her. You're running this? Unless someone else here has treated acute radiation syndrome in multiple patients simultaneously. He looked at Webb. Webb nodded. Silent authorization. Then yes, Irina continued. I am running this. Get me complete blood counts on all 3 immediately. I need baselines before the lymphocytes crash. Start IV access, wide bore, 2 lines each. Prep Prussian blue for patients 1 and 2. DTPA for patient 3. Why different chelation for the pregnant woman? Because Prussian blue crosses placental barrier. DTPA does not. The baby has chance if we use DTPA. What about the mother? DTPA is less effective, but it is her only option if the baby is to survive. A resident spoke up, voice uncertain. Shouldn't we just focus on saving the mother, the fetus at 4 months? Irina turned on him. Her gray eyes were ice. You will not make that choice. She will. We will present options. We will give her information, and she will decide who lives. Not you, not me, not anyone else. Are we clear? The resident nodded, chastened. Good, now move. The ER transformed into a choreographed dance of controlled emergency. Patients moved to isolation rooms, IVs placed, blood drawn, monitoring equipment attached. The electric symphony of machines tracking 3 people hovering at the edge of survival. Irina moved between rooms with Paul at her side, directing treatment with the precision of someone who'd done this exact dance before but never wanted to again. In isolation 4, patient 1 vomited blood. His lymphocyte count was already dropping. In isolation 5, patient 2's trembling worsened. Early neurological symptoms. In isolation 6, the pregnant woman, her name was Sofia Ruiz. She clutched the nurse's hand and asked the question Irina had been dreading. My baby. Will my baby be okay? Irina stood at the threshold in full protective gear, face shield fogging slightly with her breath. I do not know, she said, because lying would be worse. Your exposure was significant. The baby will absorb much of the radiation. We have medication that may help, but it is less effective than what we would use if you were not pregnant. What happens if you use the better medicine? The baby dies, certainly. Sophia's hand moved to her abdomen. And with the weaker medicine? You both have a chance. Not a good chance, but a chance. What would you do if you were me? The question hit Irina like a physical blow. 40 years dissolved. She was back in that tent, 12 kilometers from the reactor, watching a woman named Katya make the sane, impossible choice. Watching her choose the baby. Watching them both die anyway. I cannot answer that, Irina said, her voice rougher than she intended. This is your choice. Only yours. Sophia closed her eyes. Tears tracked down her cheeks. I want you to try to save us both. Even though the chance is small? Even though. Irina nodded once. Then that is what we will do. She turned to leave, to check on the other patients, to coordinate the 17 different treatment protocols happening simultaneously. Paul caught her arm in the hallway. You okay? No, but I will be. After. After what? After I do not lose another pregnant woman to radiation poisoning. She pulled free and kept moving. Behind them, through the observation window, Sofia Ruiz pressed both hands to her belly and whispered something that might have been a prayer. Hour 3 of the crisis, and the ER had transformed into something that belonged in a different era. Plastic sheeting divided spaces into improvised isolation zones. Dosimeters clipped to every person who entered the hot zones, clicked their steady rhythm of invisible danger. The air tasted metallic, sterile, wrong. Irina stood at the central monitoring station, surrounded by screens displaying vital signs from 3 rooms simultaneously. Her volunteer vest was gone, replaced by surgical scrubs someone had found in her size. She'd been on her feet without break for 180 minutes. Her hands were steady. Patient 1's lymphocyte count had crashed to 400. Patient 2 was hemorrhaging from his gums. Patient 3, Sophia, was stable, but her fetal heart rate was elevated, erratic. Webb approached from behind, holding his tablet like a shield. Environmental Health finished their assessment. The exposure was worse than Klein estimated, closer to 10 Roentgens, maybe more. Irina didn't turn from the monitors. Then we are past the maybe zone. We are in the prayer zone. What's the survival rate at 10 Roentgens? 5%, perhaps less. Jesus not here. We are, so we work. She moved toward isolation 4. Patient 1 had deteriorated fastest, his body already shutting down in response to the massive cellular damage. She pulled on fresh protective gear and entered. The young man's name was David Chen, 23 years old, graduate student in nuclear physics. He'd been closest to the source when the shielding failed. He was conscious but fading, his eyes tracking her movements with the desperate clarity of someone who understands they're dying. Dr. Volkov, he whispered. His lips were cracked and bleeding. Am I going to make it? She could have lied. Should have, maybe. But she'd made a promise to herself in 1986, kneeling beside a firefighter named Alexander who'd asked the same question. She'd lied to him, told him he'd be fine. He'd died 6 hours later, knowing she'd betrayed his trust in his final moments. Never again. I do not know, she said. Your exposure was very severe. Your body is fighting very hard. We are giving you everything we have. But I cannot promise you will survive this. His eyes filled with tears. I'm 23. I know. I was just trying to fix the shielding. I was trying to help. I know. She adjusted his IV, checked the chelation drip. David, I need you to listen to me. Your bone marrow is failing. In the next hours, you will feel very sick. You will bleed. You will hurt. But your brain will stay clear almost until the end. So if there are people you need to call, things you need to say, you should do that now. You're giving up on me. No, I am giving you truth. I will fight for you until there is nothing left to fight with. But you deserve to know what is happening to your body. You deserve to make choices. He stared at the ceiling for a long moment. Then, can you call my mother? Yes. And stay with me, I don't want to be alone. Something cracked in Irina's chest. 40 years of carefully maintained professional distance, splintering under the weight of one terrified boy who just wanted someone to hold his hand. I will stay as long as I can, she said. I promise. She stepped into the hallway, pulled off the protective gear, found a nurse. Get me David Chen's emergency contact, his mother. I need to make a call. The conversation with Mrs. Chen lasted 4 minutes and destroyed something inside Irina she'd thought was already broken beyond further damage. While she was on the phone, Paul found her. His face was grim. Sophia's asking for you. Something's wrong. Isolation 6. Sofia Ruiz lay with both hands pressed to her abdomen, her face twisted in pain that was trying very hard not to become panic. Cramping, she gasped. Bad cramping. And bleeding. I'm bleeding. Irina moved to the bedside. Began a physical exam with hands that stayed professional despite the trembling that wanted to start in her fingers. Bleeding. At 4 months, with 10 roentgens of radiation saturating her system, the fetus was dying. She'd known it would happen. Had known from the moment Sofia rolled through those doors. But knowing and witnessing were different countries with no bridge between them. Dr. Volkov, Sofia whispered. Please, please save my baby. Irina met her eyes. I am trying. Try harder. I am giving you every medication we have. I am doing everything medicine knows how to do. Then do something medicine doesn't know. The words hit like a slap. Irina straightened, staring at Sofia's desperate face, and something shifted in her mind. A memory. Not from Chernobyl. From before. From medical school in Moscow, when she'd read a paper, experimental, never approved. About using hypothermia to slow fetal metabolism in cases of maternal radiation exposure. Theoretical, untested, potentially fatal. But Sofia's baby was dying anyway. There is something, Irina said slowly. It is not proven, it is dangerous, but there is a technique, from Soviet research, that might slow the radiation damage to the fetus. Do it. You do not know what I am proposing. I don't care. If there's a chance, any chance, I want it. Irina turned to Paul, who had been listening from the doorway. I need ice, bags of ice, and cooling blankets. I need to drop her core temperature to slow the baby's metabolism. That's insane. You could kill her. The baby is already dying. Sofia is following close behind. This gives them both a chance. What kind of chance? I do not know. The research was abandoned in 1985, but it is a chance. Paul looked at Sofia. She nodded, fierce and certain. Get the ice, he said. They worked for 20 minutes, packed Sofia in cooling blankets, monitored her temperature as it dropped, watched the fetal heart rate slow, dangerously slow, skating the edge of cardiac arrest. Irina stood at the bedside, with one hand on Sofia's wrist, feeling her pulse, and with the other hand on the ultrasound probe, watching the tiny heart beat its stubborn rhythm against impossible odds. She was so focused, she didn't hear the commotion in the hallway. Didn't notice the new arrival until the isolation room door opened and a woman in a dark suit stepped through, flanked by 2 men in similar attire. FBI badges hung from their belts. The woman was late 30s, Hispanic, with sharp eyes and the bearing of someone accustomed to authority. She looked at Irina, at the cooling blankets, at the monitors, and her expression shifted from official to something closer to awe. Dr. Irina Volkov. Irina didn't look up from the ultrasound. Yes. Special Agent Diana Ortiz, FBI Counterintelligence Division. I need to speak with you. I am busy. I can see that, but this can't wait. Then it will have to wait anyway. I have 3 patients dying from radiation exposure. Whatever you need from me can happen after. Agent Ortiz stepped closer. Dr. Volkov, I'm not here to arrest you. I'm here because the Bureau just declassified a set of KGB documents related to the Chernobyl disaster. Your name appears in them. Extensively. That got Irina's attention. She looked up. What documents? Records of a Soviet military medical unit stationed 12 kilometers from Reactor 4, led by Senior Lieutenant Irina Nikolaevna Volkova. The unit was ordered to provide palliative care only. to let the most severely exposed liquidators and civilians die without intervention to preserve limited medical resources. Silence filled the room, except for the steady beep of monitors. You disobeyed those orders, Ortiz continued. You used military transport without authorization. You evacuated 137 people who were marked as acceptable losses. Children, pregnant women, firefighters. You brought them to a facility that actually had the equipment to treat them. You saved their lives. Irina's hand tightened on the ultrasound probe. I was court-martialed in absentia for theft of state property and treason. You were. The KGB spent 2 years looking for you after you defected. They wanted to make an example. Ortiz pulled a folder from her jacket. But the people you saved, they didn't forget. 19 of them emigrated to the United States over the past 30 years. They've been trying to find you, trying to tell anyone who would listen what you did. Why are you telling me this now? Because one of them, a woman named Katya Fedorova, saw your picture on social media. The video that volunteer posted, the one mocking you. She recognized you immediately. She contacted the bureau. She gave us everything. Testimony, documents, proof. Ortiz set the folder on the medical cart. Dr. Volkov, you didn't just save 137 lives in Chernobyl. You risked your life, your freedom, your future to do it. And then you stayed silent for 38 years. I stayed silent because I failed, Irina said, her voice raw. Because 19 people died who I could not save. Because 3 pregnant women died in my arms. You saved 137. The 19 you lost, they were beyond saving. Everyone who saw their exposure levels confirmed that. You gave them dignity. You stayed with them. That's not failure. Sophia's voice weak but clear. You saved 137 people? Irina looked down at her. It was long time ago. And now you're trying to save me and my baby? Yes. Then I'm in good hands. The fetal heart rate on the monitor steadied. Still slow, still dangerous, but steady. Agent Ortiz moved toward the door. I'll wait outside. But when this is over, there are people who want to meet you. People who owe you their lives. She left. Irina returned her focus to the ultrasound. To Sophia's steady breathing, to the fragile rhythm of a heart that refused to stop. Paul stood in the doorway. You're a hero. No, Irina said. I am a doctor who does not give up. That is all. David Chen died at 11:47 p.m., 6 hours after admission, with his mother on the phone and Irina holding his hand through protective gloves that felt obscenely inadequate for the moment. His last words were, "Thank you for not lying to me." Irina stood in the hallway afterward, still wearing the protective gear, staring at nothing while the reality settled into her bones. 137 saved in Chernobyl, 19 lost, and now David made 20. Paul found her there. Dr. Volkov, Sophia's temperature is stabilizing. The fetal heart rate is holding steady. Patient 2 is responding to treatment. His bleeding stopped. She nodded, but didn't move. You saved 2 out of 3. Against impossible odds. That's a miracle. That is 66% survival rate. Better than I expected. Worse than I wanted. You're human. You can't save everyone. I know. But I remember every single one I lose. She walked to the locker room, stripped off the protective gear, washed her hands for 3 full minutes with water hot enough to hurt. When she emerged, Webb was waiting in the corridor, with an expression that belonged on someone who just had their entire worldview surgically removed. We need to talk. He led her to his office. Agent Ortiz was already there, along with 2 other people Irina didn't recognize. A man in his 50s with Slavic features and a woman in her 40s wearing a university faculty badge. Webb gestured to them. Dr. Volkov, these people have been waiting 4 hours to meet you. The man stepped forward. His eyes were wet. Dr. Volkova, я Mikhail, вы спасли мою жизнь в Чернобыле. Russian. He was speaking Russian, calling her by her Soviet name. Irina's breath caught. Mikhail Romanov? Da. Yes, you remember. You were 14. You lived in Pripyat. Your mother brought you to the mobile unit with acute nausea and fever. Your exposure was 8 Roentgens. You evacuated me, against orders. You put me on a military truck with 16 other children. You saved my life. Tears tracked down his face. I have spent 38 years looking for you. To say thank you. To tell you that I lived. That I married. That I have 3 children. That I became engineer because you showed me what one person with courage can do. The woman stepped forward. Dr. Volkov, I'm Professor Anna Kerrigan, MIT. I was Anna Sokolova in 1986. I was 7 months pregnant when the disaster happened. I was a teacher in Pripyat. You evacuated me and 12 other pregnant women to Kiev against direct orders. Irina stared at her. Anya. You were Anya. Yes. My daughter. She's 37 now. She's a physician in Seattle. She exists because you refused to follow orders. Because you decided our lives mattered, even when the Soviet government said we were acceptable losses. Webb cleared his throat. Dr. Volkov, the FBI has been collecting testimony for the past 6 hours. 19 survivors are in the United States. All of them confirmed the same story. You led a covert evacuation operation that saved 137 lives. You exposed yourself to near-lethal radiation doing it. And when the KGB came looking, you disappeared rather than endanger the people you'd saved. I did what was necessary. You committed treason against a superpower to save children. The superpower was wrong. The children were not. Ortiz opened her folder. The declassified documents show you were exposed to cumulative radiation of approximately 12 Roentgens over 8 months. You should have died. The fact that you didn't is either incredible luck or incredible stubbornness. Both, probably. Mikhail moved closer. Doctor, the survivors, we have been talking. We want to establish a fund in your name for training emergency medical personnel. Sananel, for radiation response, for no. The word came out harder than she intended. Everyone stopped. No funds, no memorials, no publicity. I did my job, that is all. But people should know what you did. Why? So they can call me hero? I am not hero. Heroes do not lose 20 people. Heroes do not spend 38 years hiding because they are afraid. Heroes do not stand in hospital hallways and watch children die. Her voice remained level, but something underneath it was fracturing. I am doctor who did what doctors do. I tried to save lives. Sometimes I succeeded. Often I failed. This does not make me special. Webb spoke carefully. Dr. Volkov, I owe you an apology. I dismissed you. I treated you like you were incompetent. I was wrong. You were wrong about my competence, but you were right to be cautious. I am volunteer with no current credentials. You protected your patients. This is your job. You saved 3 lives today that I couldn't have saved. You would have found a way. No, I wouldn't have, because I didn't have the knowledge, the experience, the willingness to try something insane because conventional medicine had already failed. He paused. The hospital board wants to offer you a position. Attending physician, specializing in emergency medicine and disaster response. We want to build a program. Training protocols for mass casualty radiation events. You'd lead it. Irina looked at him for a long moment. I am 68 years old. I have been retired for 5 years. I pour coffee and sort magazines because I am tired of making life and death decisions. Are you? Because you just spent 8 hours making nothing but life and death decisions, and you were brilliant. I was adequate. You were extraordinary. She turned away, moved to the window. Outside, dawn was breaking over the parking lot. Pale light touching the ambulances, the empty gurneys, the normal geometry of a hospital preparing for a normal day. Except nothing about today had been normal. When I defected, she said quietly, I promised myself I would never practice crisis medicine again. I would treat ordinary illnesses, help ordinary people with ordinary problems. No more triage. No more choosing who lives and who dies. No more standing beside beds, watching radiation eat people from the inside out. She pressed her palm against the glass. I wanted peace. Did you find it? No, because peace for me feels like cowardice, like hiding, like pretending I do not have skills that could help people because using those skills hurts too much. She turned back to face them. I do not want position. I do not want title. But I will help you build the program. I will teach. I will consult. And when there is crisis, I will come. On my terms, in my time. As volunteer. Webb nodded slowly. That's acceptable. And the pugnacity, The media, the story about Chernobyl, it stays quiet. I do not want attention. Ortiz winced. That might be difficult. The volunteer coordinator, Jessica Reeves, she's been posting videos. The story is already spreading online. People are calling you the Chernobyl angel. I am not angel. Angels do not lose count of their failures. No, Mikhail said softly. But angels save people who have no hope left. You saved me when I had no hope. You saved 136 others. This is not failure. This is miracle. Irina looked at him, at the grown man who'd been a terrified 14-year-old in a contaminated evacuation zone, and something in her chest loosened. Not healed, not forgiven, but loosened. Perhaps, she said. Perhaps it is both. Miracle and failure. Success and loss. This is medicine. This is love. Anna stepped forward and took Irina's scarred hands in hers. My daughter wants to meet you. Will you let her? Pause. Then. Yes, I will meet her. I will meet all of them, if they wish. But not as hero. As doctor who did her job and was lucky enough to succeed sometimes. That's enough, Anna said. That's more than enough. The office door opened. Paul looked in, urgent but controlled. Dr. Volkov, Sophia's asking for you. She wants to know if the baby's okay. Irina pulled her hands free gently. Then I should go tell her. She walked out, leaving the FBI agent and the survivors and the job offer behind. Because a patient needed her. Because that was the only title she'd ever wanted. The only identity that mattered. Doctor. The one who shows up. The one who stays. Tays. The one who refuses to give up even when giving up would be easier. She found Sophia, awake in isolation 6, her temperature back to normal, her hands still pressed protectively to her abdomen. The baby? Sophia whispered. Irina pulled up the ultrasound. Found the heartbeat. Strong, steady, stubborn. Your baby is fighter, she said, like the mother. Sophia started crying, relief and gratitude and exhaustion all mixed together. Irina stayed until she fell asleep. Then she walked out into the morning light, pulled her volunteer vest back on over the borrowed scrubs, and went to pour coffee for the families in the waiting room. Because someone needed to, and she was there. 6 months later, a hospital conference room held 40 people, but it felt more like a classroom than a meeting. Physicians, nurses, paramedics, and emergency coordinators sat in rows facing a simple podium. No PowerPoint, no fancy graphics. Just Irina Volkov standing in front of a whiteboard covered in handwritten notes about radiation exposure protocols. She wore the same practical cardigan and simple slacks she'd worn as a volunteer. No white coat, no name badge proclaiming credentials. Just gray hair in a bun and those steady hands that never quite stopped moving when she taught. Acute radiation syndrome presents in 4 stages, she said. Her accent still present but softer now that she spoke more often. Prodromal, latent, manifest illness, and either recovery or death. The prodromal stage is your diagnostic window. This is where you save lives or lose them. A young resident raised his hand. How do you differentiate ARS from food poisoning or flu in the first hour? You ask questions. Was patient near industrial source, research facility, medical equipment? You look at skin. Radiation erythema appears differently than sunburn. You check multiple patients. Radiation events rarely affect only one person. She wrote on the board, and you trust your instinct. If something feels wrong, investigate. Paul Hendricks sat in the back row, arms crossed, watching her teach with the quiet satisfaction of someone who'd been right about something important. Beside him, Dr. Webb took notes like a medical student, his earlier arrogance replaced by genuine respect. The training program had been Irina's compromise. She wouldn't take a position, wouldn't accept a salary beyond minimal consulting fees, but she would teach. 2 days a week, she ran disaster medicine seminars that had quickly become the most attended sessions in the hospital's continuing education program. Word had spread. Physicians came from other hospitals. Paramedics drove 2 hours to attend. The woman who'd saved 137 lives in Chernobyl was teaching everything she knew, and people were desperate to learn. Dr. Volkov, another voice, this one from a middle-aged EMT in the 3rd row. What do you do when you have more critical patients than resources? How do you choose? The room went silent. Irina set down the marker. You do not choose who dies. You choose who has best chance to survive with available resources. This is different thing. Subtle, but important. She paused. In Chernobyl, we had 3 categories. those who would survive without intervention, those who would die regardless of intervention, and those for whom intervention made difference. You focus everything on the third group. Doesn't that feel like playing God? No. It feels like being doctor in impossible situation. God does not have to make these choices. We do, and we live with them afterward. Her voice remained steady, but her eyes carried weight. I remember every person I placed in the second category, every face, every name. This is the cost of triage. You carry the ones you could not save. The EMT nodded slowly. How do you cope with that? You do not cope. You accept. You acknowledge. You remember, and then you save the next person. Because forgetting the dead dishonors them, but letting the dead prevent you from saving the living dishonors everyone. She returned to the whiteboard, writing treatment protocols in clear block letters, and the seminar continued for another 90 minutes. When it ended, people lingered, asked questions, requested advice on specific scenarios. Irina answered each one with the same patient precision she brought to everything. Webb waited until the room cleared, then approached. The board approved the expanded program. We're partnering with 3 other hospitals in the region. They want you to run regional disaster medicine training. I said I would consult, not run. You're already running it. You just don't have the title. She gave him a look that might have been amusement. I do not need titles. I know. But the program needs legitimacy, funding, official recognition. That requires someone with credentials at the helm. Then find someone with credentials. I did. You. MIT verified your Soviet medical degree. The State Medical Board approved your license reactivation based on your experience and the recommendation of approximately 200 physicians who want to study under you. He handed her a folder. You're legal to practice again, officially. Irina opened the folder, stared at the medical license with her name printed in official typeface. Dr. Irina Volkov, active status. She'd surrendered her license 5 years ago when she retired, had never expected to hold one again. I am 68 years old. So, I cannot work full-time. I'm offering part-time, training, consultation, emergency response when needed. You set the schedule. She closed the folder. I will think about it. That's not a no. That is not a yes either. She left the conference room and walked through corridors that felt different now. People nodded as she passed. Residents asked questions. Nurses stopped to thank her for something she'd taught them that had helped a patient. She was visible now, known. The story had spread despite her objections. The Chernobyl angel, the woman who saved 137 lives and then disappeared for 38 years. She hated the nickname, but accepted the recognition. Because it came with responsibility. People who'd heard her story reached out. Other refugees with medical training who'd been dismissed as unqualified. Veterans with combat medical experience who couldn't translate it to civilian credentials. Older physicians forced into retirement who still had knowledge worth sharing. Irina had started meeting with them, advising them, connecting them with programs, building a network of overlooked competence that the medical system had been ignoring. She found Sofia Ruiz in the outpatient waiting area, 7 months pregnant now, glowing with the specific radiance of someone who'd been told they wouldn't make it this far and proved everyone wrong. Dr. Volkov. Sofia stood, slower now with the wait. I was hoping I'd see you. How are you feeling? Tired, nervous, excited, all of it. She placed with hands on her belly. The baby's moving constantly, strong. The obstetrician says everything looks perfect. Good. This is very good. I'm naming her Irina, if that's okay. Something caught in Irina's throat. You do not need to do that. I want to. So she knows who saved her life before she was even born. So she grows up understanding that sometimes one person refusing to give up makes all the difference. Irina touched Sofia's hand briefly. Then I am honored. Thank you. After Sofia left, Irina sat in the waiting area for a moment, watching people come and go. Families worried about loved ones. Patients trying to stay brave. Staff moving with purposeful efficiency through organized chaos. This was where she belonged. Not in the spotlight. Not in ceremonies or media interviews. Here, in the margins. In the spaces between crisis and calm. Ready to step forward when needed. Content to step back when not. Her phone buzzed. Text message from an unknown number. Dr. Volkov, this is Katya Fedorova. I was one of the pregnant women you evacuated from Chernobyl. My daughter is 37 now. She just finished her residency in emergency medicine. She wants to meet you, to learn from you. Would you be willing? Irina stared at the message. Katya. She remembered. 7 months pregnant. Terrified. Exposure moderate but dangerous. Irina had put her on the truck, had stayed with her during the evacuation, had helped deliver the baby 3 weeks later in a Kiev hospital. Both had survived. And now the daughter was a physician. She typed, "Yes, I would be honored to meet her." Another message came through immediately. "Thank you. She says you're the reason she became a doctor. Because her mother told her about the woman who refused to follow orders that would have killed them both." Irina closed her eyes. 137 saved. David Chen lost. 19 others lost in Chernobyl. Yael, but 137 lived. Had families, had children, had futures that shouldn't have existed. And some of those children became doctors. The math of it was overwhelming. Paul found her in the waiting area. "You okay?" "I am remembering why I do this work. Even when it is hard. Even when I lose people. Even when I want to hide. And I am glad I stayed. I am glad I came back. I am glad I did not let fear make me small." He sat beside her. "The hospital board wants to name the new disaster response training center after you." "No. I told them you'd say that. They're doing it anyway. Call it the Volkov Center for Emergency Excellence." "That is a terrible name. I agree, but it's happening. You saved 137 lives in Chernobyl. You saved 3 lives here. You're training hundreds of medical professionals who will save thousands more. Your impact is exponential. They want to honor that." She shook her head but didn't argue further. "I just want to do the work." "I know. That's why you deserve the recognition." They sat in comfortable silence for a moment. Then Irina stood. "I should go. I have meeting with young doctor from Syria, refugee. Worked in field hospital in Aleppo for 3 years. Very skilled. No credentials recognized here. He is working as medical translator. Waste of talent. You're going to help him?" "I am going to try. He has knowledge that cost him everything to gain. People should benefit from that knowledge." She walked toward the exit, then paused, turned back. "Mr. Hendricks, thank you. For recognizing me, for pushing me, for not letting me hide. You're welcome. But you did the hard part. You showed up. You stayed. You refused to give up." She nodded once and left. Outside, the afternoon sun was warm. The parking lot was full. Life was continuing in its messy, complicated, beautiful way. Irina pulled out her phone and called the Syrian doctor. "Dr. Haddad, this is Irina Volkov. I've been thinking about your situation. I may have some ideas. Would you like to meet for coffee?" His voice, desperate and grateful, came through. Yes, please, thank you." "Good. I know a place. We will talk. We will find a way." She ended the call and walked to her car. An old Honda with 200,000 miles that ran perfectly because she maintained it with the same methodical care she brought to everything. Her volunteer vest lay on the passenger seat. She'd kept it, a reminder of where she started, of who she'd been when people dismissed her as just an old woman playing at medicine, of how wrong they were. She drove home through familiar streets, past the hospital where she'd once hidden and now taught, past the coffee shop where she'd meet Dr. Haddad tomorrow, past the ordinary geography of a life rebuilt from ashes. At home, she made tea, sat at her kitchen table, opened her laptop. An email waited from Anna Kerrigan's daughter, Dr. Elena Kerrigan. The subject line read, "Thank you for saving my mother's life so I could exist." Irina read it slowly, read about Elena's work in Seattle, about her research into radiation treatment protocols, about how she'd chosen emergency medicine because her mother had told her stories about a doctor who refused to follow orders that would have killed them. At the bottom, a question. Would you be willing to collaborate on a research paper about long-term outcomes for in utero radiation exposure survivors? I think your experience could revolutionize how we approach these cases. Irina sat back, sipped her tea. Then she began typing. Dr. Kerrigan, I would be honored to work with you. But first, tell me about yourself. I want to know what kind of person you became. Because that is the real measure of whether I succeeded. Not that you survived, but that you thrived. That you became someone who helps others. This is what matters. This is what makes the hard choices worth making. She hit send. Outside her window, the sun set slowly. The sky turned orange. then pink, then purple. Somewhere, Sofia Ruiz felt her baby kick. Somewhere, Mikhail Romanov hugged his children. Somewhere, 137 people lived lives that shouldn't have existed. And in a quiet kitchen in a modest house, an elderly woman, who'd once been called a traitor and was now called an angel, just smiled softly and poured herself more tea. Because she was neither. She was just a doctor who showed up, who stayed, who refused to give up. And sometimes, that was enough.